Hey, it's your old pal, Dr. Steve, and welcome to the SARS-CoV-2 COVID-19 updated situation report for June 21st, 2020. Happy Father's Day to the fathers out there. This is the 12th in a weekly series. Previous episodes are available and have general information about the current pandemic, antivirals, vaccines, and basic science that are not covered on a weekly basis, so go check those out. Okay, let's get started with the current statistics that we're following. Okay, the numbers this week don't show very many surprises. World total is up to about 8 million cases. The United States at 2.2 million cases. Our deaths per 100,000 are about 36, which we rank 9th in the world for deaths per 100,000 or death per population, and that's remained unchanged. The next two, as last week, were Brazil and Russia. Last week, Brazil had about 850,000 cases. Now they're up to 1.032 million cases. Again, this doesn't necessarily denote sick people. This could be related to testing. So, we have to discern whether new cases means that we're testing a whole lot more people and then picking up a lot of asymptomatic cases, or are we talking about sick people? And that's very difficult to do sometimes. So here we are looking at cumulative cases in the top three. So United States is in green at the top, and you can see a linear increase. Brazil shows some tapering, but that may be due to reporting. And Russia, same deal. All of these are linear with not completely dissimilar slopes, but they're not exactly parallel either. So we look at cumulative death rates. Brazil, their line is increasing steadily. The United States is just starting to curve to the right, and you can see the United Kingdom, Italy, France, and Spain have all flattened their death rate curve significantly. This is very important because that curve can never decrease. It can only go horizontal. Once you hit zero deaths, then it will be perfectly horizontal. So you can see that the United States was doing reasonably well as far as new daily cases. And the Bollinger Bands, if you're not sure what I'm talking about, go back a few episodes and we discussed what Bollinger Bands are. It's basically a statistical technique to visually show the standard deviation of the data that you're getting. And so the narrower they are, the more consistent the numbers are. So if it's always 20, for example, 2020, 2020, well, then the Bollinger Bands will be very narrow. Matter of fact, there will be no deviation, so they will be right at the line. Anyway, we use those because the green line, which is the new cases line, should bounce around inside those bands. And when they jump out of the bands, then there is an outlier in the data, and where the new cases have outstripped the standard deviation of the past 20 days. And if they hug the bottom band, you have a declining trend. If they're hugging the upper band, you have an increasing trend. And you can see that our new cases just rose above the upper band on about June 18th to 19th. So we'll be watching that over the next week. Georgia last week, stay-at-home order expired on May 1st, and this was last week's curve, showing just at the right side some touching of the upper Bollinger Band with the new cases line. This week, mirroring the United States, the cases have jumped above the upper Bollinger Band and are increasing significantly, so we'll see what happens over the next week. That's a very large increase, much larger than anything we've seen over the last 50 days. However, new hospitalizations continue to be static or maybe slightly decreasing. But of course, any cases that we have today most likely will not be hospitalized right away. So the next 2 weeks to 4 weeks will really tell the tale on that. I couldn't get hospitalization data from the data lake that Stout Labs is using at covid.stoutlabs.com. I did find this from the New York website, and their hospitalizations have decreased significantly. And the link for New York data, if you're interested in New York or live in New York, that link has got a lot of robust numbers and graphs that you can examine. So that's looking pretty good. Florida also showing an increase in new daily cases and increasing above the upper Bollinger Band, whereas new hospitalizations may be creeping up some over the last 20 days. If you look at that simple moving average, seems to be increasing slightly since June 7th. Here's new daily cases in Texas, also above the upper Bollinger Band. New daily deaths, however, showing, if anything, a very slight increase, and that will be worth watching over the next several weeks. California is still showing some increase, not quite, well, maybe just slightly above the upper Bollinger Band on June 18th, but certainly hugging that upper band and showing a general uptrend. Now, R sub T has been recalculated on RT Live, or RT.live. And if you remember from last week, Hawaii was maybe the lowest R sub T, and R sub T is the average number of people who become infected by an infected person using real life data. So this is not the theoretical R sub 0, which is the potential for infection if someone is infected in a population that's totally susceptible to it. So we know there are some people that are naturally immune to this. We don't know how to identify those people ahead of time. It would be great if we could. And we also know that there are some people who have already been infected and likely have immunity. So the R sub 0 isn't as useful as the R sub T. So right around the center of this graph, you can see Washington State and Michigan are right around R sub T of 1, which means there's a linear increase in total cases. If each one person gives it to one person, then if you have 20,000 people that have it, they'll give it to 20,000 people, and it'll be the same number every day. So the increase in cumulative cases will be linear. Where R sub T is less than 1, the virus will eventually stop spreading. We're looking at Massachusetts, District of Columbia, Connecticut, New Jersey, Illinois, Minnesota, and Rhode Island are taking the lead on that. Right now, the cases with the highest R sub T are Hawaii, Florida, Montana, Nevada, and Arizona. So we'll make this quick today since it's a holiday. Last week we talked about ACE and ARB use not being a danger, and the initial fear was that ACE inhibitors and angiotensin receptor blockers would upregulate receptors that SARS-CoV-2 uses to invade cells. So let me explain that just for a second if you're new. The SARS-CoV-2 virus has a spike protein that attaches to a receptor in the body called angiotensin receptor. And there are certain blood pressure medications that block those angiotensin receptors. And the fear was that when you block a receptor in the body will make more receptors. And therefore, you would have more sites that this virus could attack. And last week, we showed that studies have indicated that ARB and ACE use was not a danger. It didn't seem to make people worse. But there was recent results of a data mining study that showed that the use of ACE inhibitors was associated with almost 40% lower risk for COVID-19 hospitalization for older people that were enrolled in Medicare Advantage plans. So these people that were on these very inexpensive blood pressure drugs who were on Medicare so they could track what prescriptions they had. They had a significantly lower hospitalization risk. However, there wasn't any benefit noted for either younger people on commercial insurance or in either group on angiotensin receptor blockers, which is upsetting to me because I'm on one of those and not an ACE inhibitor. But it's good news. There's a little bit of news on Favipiravir. It's now approved both in Russia and India to treat COVID-19. It inhibits viral RNA, but not human RNA or DNA synthesis, so it makes it a pretty safe drug. The problem is it can't be given to pregnant women because there is some suggestion that it may be teratogenic, in other words, may cause birth defects, but otherwise seems to be very safe. It's already on the market in Japan for influenza. So there was this Russian study. They took 60 patients with SARS-CoV-2. 40 were treated with Favipiravir, and the body temperature of 68% of the patients taking the Favipiravir returned to normal earlier on the third day than in the control group. So it was on the sixth day, so they cut the time in half. On average, complete elimination of the virus from the body occurred in 4 days in the treatment group, and it took 9 days in the normal group. And following the first 4 days of treatment, 65% of the 40 patients who took Favipiravir tested negative for the virus, which is twice as many in the standard therapy group. So FDA analysis and approval is pending, and multiple trials are ongoing with good data in the United States expected by mid-July. Dexamethasone was shown effective in reducing mortality in severely ill COVID-19 patients. If you remember, the remdesivir study showed a decrease in mortality, but it wasn't statistically significant because they had to stop that arm early. So dexamethasone is actually the first drug that's been shown to decrease deaths in COVID-19. It's not a new drug. It's a steroid we use all the time. And we use it for nausea because it's a central anti-nausea medication. We'll use it for bone pain in some patients. We'll decrease peritumor edema, or in other words, swelling around tumors that are maybe blocking someone's bowel. And dexamethasone is a wonderful drug. And it's really no surprise that it helps the sickest patients in COVID-19 because the hypothesis is that it is preventing death by reducing the effects of Cytokine Storm. And we'll talk about that in just a second. If you want to look at this, you can go to recoverytrial.net. So what they did was they took 2104 patients and they were randomized to receive dexamethasone 6 milligrams once a day for 10 days. And that's a very low dose. Sometimes we'll give people 6 milligrams every 6 hours. And they were compared with 4,300 plus patients that were given usual care alone. And among the patients who received the usual care alone, the 28-day mortality was highest in those that required ventilation. So if they had to be put on the ventilator, 41% of those patients died. And it was intermediate in the patients who required oxygen only. So if you just went in and you had low oxygen, they had to put you on oxygen, 25% of those patients died. And lowest among patients that didn't require any respiratory intervention, but look, 13% of those folks still died. These are hospitalized patients. So dexamethasone reduced the deaths by 1/3 in the ventilated patients and by 1/5 in the other patients receiving oxygen only. So it had a more profound effect on the sickest patients, the ones that had to be placed on the ventilator. There was no benefit among those patients who didn't require respiratory support. And this makes total sense because we're not treating the virus. We are treating the immune system's reaction to the virus. So we can do a number needed to treat based on these results, and 1 death would be prevented by the treatment of 8 ventilated patients. So that's great. And remember, not all ventilated patients die. 40% of them do. So let's talk just a little bit about cytokine storm, what it is. In some patients, the body's immune system overreacts to the virus and mounts an attack on the cells that contain it. And cytokines are these proteins that are released by cells of the immune system, and they cause excessive inflammation, which explains why would a virus that's basically in the respiratory tract all of a sudden cause kidney failure or thrombosis of the arteries in the hand, for example. And now we understand why, because when you undergo cytokine storm, all those proteins are released in the bloodstream, and they'll settle wherever they settle. So if they settle in the blood vessels, they'll cause inflammation there, which can cause thrombosis, which can cause COVID toes, for example, or settle in the kidneys and cause inflammation there, which can cause renal failure. So dexamethasone dampens this response, reducing the cytokine storm, and prevents massive inflammation that's seen in all these end organs that are distant from the original infection. So this is very good news, just something else we can add to our toolkit to treat people until we have some more robust ending to this. So in the meantime, stay healthy, reopen but be smart. Physical distancing, hand washing, and cloth face coverings are still very important tools to keep that R sub T low and help you prevent yourself from getting infected and to help you prevent infecting other people if you are infected. Do not lose hope. There's absolutely light at the end of the tunnel. This thing will have an ending. And don't forget, the Roaring Twenties came out of the pandemic of 1918, so our version of the Roaring Twenties should be astoundingly epic. So I'm looking forward to that. Check out our Twitter at Weird Medicine, or podcast at thelaughbutton.com, and SiriusXM and Faction Talk Saturday nights at 8 p.m. Eastern, Sunday at 5 p.m. Eastern, and particularly on demand. Thanks for watching. We'll see you next week for the Weird Medicine COVID-19 Situation Report. Take care, everyone.